Health insurance, you pay for it. You can hopefully help that it protects your family from unexpected, expensive medical costs. All of us do, of course. So if you and your spouse or partner have health insurance, you may think your family is what is defined as double protected. However, the CBS 11i team explains that is often not the case. Tonight, investigator Brian New working to get to the bottom of double insurance trouble.
Do pink?
Parents know when you have a child, there is always something to worry about.
What?
But Lauren and Chris Lewis say when their son Langston was born, what they did not worry about was the hospital bill. They thought they were covered. In fact, they were double covered.
Absolutely. I mean, obviously I have insurance. My wife has insurance.
So we thought that we were very covered.
But the Lewises soon found out having two insurance plans at times can feel like having none.
It's just not right.
14 months after Langston was born, the Lewises received an unexpected notice from Baylor Scott and White Hospital. It was a bill for the birth of their son for more than $4,000. After a year of negotiating with their insurance companies, the hospital told the Lewises both of their plans had declined to pay.
Now, here we are with this, $4,700 bill, and we're just still trying to figure it out. You know, it's like, well, do we gonna have to pay out of pocket for this cost? And like, it don't make any sense.
So how could insurance companies simply decline to pay a medical expense that is covered under their plan? The answer is in the rules. So Langston's mother had health insurance with United Healthcare. The insurance company told us it follows what's known as the birthday rule. The birthday rule says when both parents have separate insurance, the parents whose birthday falls first in the calendar year is whose insurance is responsible to cover the birth of the child. And in this case, that would be Langston's father. But here's the problem. Not every insurance plan follows that rule. Langston's father has insurance with Care First Blue Choice. His insurance company told them when both parents have insurance, under its rules, the cost of the baby goes to the mother's insurance. So in the end, you have two different insurance companies playing by different rules, both pointing the finger at the other.
When that happens, more often than not, is that the patient or the consumer falls through the cracks and gets stuck with the bill.
Sabrina Corlett is the director at the Center on Health Insurance Reform at Georgetown University. She says the reason insurance plans don't all have to follow the same rules is because not all insurance plans are regulated by the same government agency. Here in Texas, most employer-sponsored health plans are regulated by the U.S. Department of Labor. 38% of Texans have these plans. The Texas Department of Insurance, meanwhile, regulates fully insured plans held by 15% of Texans. Then there are government plans such as Medicare, Medicaid, and military plans. 30% of Texans have these plans, which are regulated by the U.S. Department of Health and Human Services. And that doesn't include the roughly 17% without insurance.
In the U.S., we have this very fractured system of health insurance. The burden is almost always on the individual, on the consumer to navigate that system. And, big trouble for you if you get it wrong.
The House will be in order.
Last year, federal lawmakers introduced the Empowering Parents Health Care Choice Act. The bill would give parents with dual insurance plans the right to choose which health plan would be the primary insurer. The bill is currently in the House Subcommittee on Health. But even if passed, the law would not apply to all health plans, only those regulated by the federal government.
Everybody should follow the same rule.
After the I-Team contacted both of Lewis's insurance companies, the Dallas couple received a call from the hospital. Baylor Scott and White told them it is working with Care First Blue Choice to cover the bill, and that the Lewises no longer needed to worry about paying it out of pocket.
Would you all have been better off if one of you didn't have insurance?
We definitely would have. Yet we are in a situation where the insurance company is able to get away with saying, hey, it's not our responsibility because they follow different rules. And it's not right.
Yeah, you see.
So health insurance experts told us why it may sound counterintuitive if you can avoid having duplicate insurance plans. You may think, like the Lewises did, you're simply getting extra coverage, but oftentimes the opposite is true. Now, if you are having an issue with your health insurance covering what they should, the Texas Department of Insurance encourages you to call its helpline. We have that number below. We also have it on our website at cbsdfw.com. But Steve, remember, as we were just talking about, the Texas Department of Insurance can only regulate state plans. So there's only so much it can do if your plan is not regulated by the state.
Fascinating to watch. They have protection, and in some cases, no protection. Brian, thank you so very much. We appreciate it.